I'm Alicia.
I'm Andrea, and we're both nurses on the labor and delivery unit here at the hospital.
And we are this month's Patient Experience Award winners for Philanthropy.
We were both nearing the end of a long 12-hour shift. Shift change was coming up. We were going to pass our patients off and go home. And a patient came in through our triage and thought that her water had broke. And so we got her in her room, we examined her. Her water did in fact break, and she was 6 centimeters, and she informed us that she was actually scheduled for a C-section the very next day in St. Louis. And her baby had recently been diagnosed with fetal height drops, which in a nutshell is not something that you want to be diagnosed with whenever you're pregnant. And the outcome of it is pretty poor most times. So she was nervous, to say the least. We knew that we needed to transfer her out as soon as possible.
Obviously, air transfer was ideal in this type of situation, but the weather that evening was not good. It was snowing, so air transfer at that point was grounded. We contacted our local ambulance facilities. They were already out on calls because of the weather, so finding her transportation was difficult, but at the nick of time, an outlying county actually accepted transfer. So once they were here on the unit, they received a report on the patient, and at that point they knew how serious our situation was and how important it was to get the patient to a higher level of care. They felt better if a couple nurses would ride along just in case, since the patient was so far advanced dilated. If delivery was needed en route, we would be there with her. Also at this point, and any patient during any type of transfer, they get scared. Everything's happening so fast, it's a lot to process. And this particular patient, she was already dealing with so much, trying to process a late diagnosis of, her baby having a fetal diagnosis that was of poor outcome. So we really felt for this patient and felt like this was a good opportunity to be there with her to support her. So we successfully got the patient to the accepting facility where there was an OR team waiting along with a team of NICU specialists.
I think as nurses, a lot of times we can get stuck in a rut because our job is so routine. This could be, for us, the second demise of the month that we've taken care of, or the third stroke of the week, or the second heart attack of the day. And to us, it's so routine, but to the patient, it could be a once-in-a-lifetime experience for them, and they're scared, they don't know what to do, they're unsure of what the future holds. And I think as nurses, that is a prime opportunity to give a little more of yourself in that situation to make them feel better. And so that's what philanthropy means to us.